They heard about people who were stricken with disease. Unafraid, they traveled to a place far away in the middle of the Pacific Ocean, not knowing what to expect. They were hungry to serve those who no one wanted to serve. While others turned their faces, they wanted to be near, driven by compassion and doing what was right in the eyes of God. Wherever there was a need, St. Marianne Cope and the Sisters of St. Francis rose to the challenges before them to meet those needs. Against all odds, they persevered and never gave up. They always found a way to break through barriers, hungry to serve others, especially the most vulnerable. The moment they said yes to God in their hearts, they remained steadfast in their commitment to serve those with Hansen's disease. Although the Sisters of St. Francis were trailblazers, their path was not an easy one. They labored in less than ideal conditions with limited resources. Yet for every solution, they came up against still more challenges. But they never gave up. The sisters thrived on change. They were adaptable, flexible, and always open to the providence of God. True to St. Marianne's words, they made use of every fleeting moment, doing good for those around them. Through every new program they opened and every program they closed or allowed others to carry on, the Sisters of St. Francis have had an enduring commitment to serve Hawaii's people. This same spirit of compassion and tenacity drives St. Francis healthcare system of Hawaii forward today. Like St. Marianne and the sisters who started this legacy of caring, we remain rooted in the gospel and recognize we are all called into this healthcare ministry to deliver health and healing to all. Today, St. Francis healthcare system provides a wide range of services. St. Francis Hospice provides home hospice care and inpatient hospice care at Nu'uanu. In-home bathing and personal care services for those who need assistance with caring for themselves. Adult daycare in Manoa and Ewa to meet the needs of seniors and caregivers. A flourishing preschool as a separate program at the St. Francis Intergenerational Center. Franciscan Vistas Ewa, an affordable, independent living community for seniors that is always in high demand. A homeless outreach and transitional program at Our Lady of Kea'au in Waianae, and a bone marrow donor registry to find a match so patients can have the life-saving transplant they need. We are called to change lives, to touch the hearts of others in lasting ways. We are in the business of creating healthy communities, reducing health disparities, and transforming society. It is a vision inspired by God. It's stretching us in exciting ways, opening our eyes and hearts to new possibilities and causing us to grow individually and together as a team. We are a sponsored ministry of the Sisters of St. Francis, and each of us is called to carry on their work. We co-labor with them to uphold high standards of quality care. We carefully select partners who share our vision and values to work alongside us in perpetuating our inherited legacy of caring. We already have on the Liliha campus partner organizations that complement our existing services. In addition to numerous individual physician practices, we have the Cancer Center of Hawaii, Liberty Dialysis, Hawaii Endoscopy Center, PharmaCare, and others. Hawaii Diagnostic Radiology Services, one of the leading medical imaging providers in the state, is one of the major tenants on campus, providing expert diagnostic medical imaging services for patients. Hawaii Pacific Neuroscience, a leader in neuroscience care and research in the state of Hawaii and the Pacific region, will anchor the other side of the first floor of the Sullivan Building. Through their interdisciplinary team, Hawaii Pacific Neuroscience delivers the most advanced neuroscience care and research, including care for those with Alzheimer's disease and related dementias. But our work is not over yet. We must change as the needs of the community change. With Hawaii's rapidly growing senior population, we must be ready to care for them. We turn to St. Marianne and the Sisters as our examples. In their humility, the Sisters recognized they could not complete their pioneering work alone. They sought other partners and benefactors to help meet the needs of the community. St. Francis Healthcare System recognizes we have a big responsibility and a big vision. The transformation of our Liliha campus into the St. Francis Kupuna Village is our latest venture. We envision a welcoming haven of health and wellness for Hawaii's growing number of seniors and their caregivers, a place for quality care for the body, soul, and spirit. It is one of the biggest undertakings in the history of St. Francis. It will not occur overnight. The complete transformation is projected to cost nearly $80 million over several years, and we will continue to invite partners who share our mission to help us meet the growing, ever-changing needs of the community. The St. Francis Kupuna Village will offer seamless transitions across the continuum of care. It will include the Clarence T.C. Ching Villas, a skilled nursing facility for those who are discharged from the hospital and may need specialized care or rehabilitation before returning home. In collaboration with partners, our future campus will also offer a senior community center, adult daycare and adult day health, an assisted living facility, and an independent living complex. Exciting changes are happening at St. Francis. St. Marianne and the Sisters serve as our inspiration as we move forward together to create a vibrant, sustainable healthcare system. We are stewards of this great legacy, and like St. Marianne and the Sisters, we are willing to give our all so we can provide quality, compassionate care in our islands for all those in need for years to come. Let us be like the Sisters, unafraid to chart new territory, open to new challenges, and ready to find new solutions to create healthy communities. The stage has been set. We are moving forward to create change. With God, all things are possible.